Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. Here we're at 888-630-9625. That's 888-630-WMAL. I'd love to talk to you on any subject you have in mind, even though that's hot and nasty and ugly outside, and some of you, thousands and thousands of you, are without power. Guess what? This is a breath of fresh air, something that you can lock onto and make a difference, and we'll talk a little bit about how to keep yourself from, kind of going under from too much heat and too much stress and too much exhaustion today. But we're also going to talk about a couple things that patients keep asking me about, and one of them is plantar fasciitis. That's when your foot hurts, and you go to the doc and he says, well, you have plantar fasciitis. Well, we're going to tell you what that really is and how it comes about, and because some of you aren't runners, and some of you, do very, very little exercise, but your feet hurt anyway. In the second half of the program, we're going to talk about a group of people over in the Mediterranean, close to Greece, close to Turkey, that seems to have more people living into their 90s and also centenarians than any place else. What is it about these people, and what do they eat, and how do they do what they do? And we're going to kind of talk about that as well. So if you want to talk to me, 888-630-9625. If you had a problem, you've tried, you've applied. Guess what? Here I am again. This is your place to get those questions answered completely and straight up, without drugs, without surgery, the way they should be. And, you are the commander of your ship. We talk about ageless health all the time, and it's my mantra, it's my tag, if you will. And what I really want you to understand about ageless health, and Health is a Do-It-Yourself program, which is, by the way, the title of my book, and all of you should have a copy of it. And if you don't, go to rosellecare.com and pick one up. But more importantly, what I want you to understand is Health is a do-it-yourself program, and ageless health is simply this, that at any age you can be healthy. You just need to know what the tools are and how to put it all together. If you have the tools, you have the capacity. You just got to change the way you think, and we're going to change the way you think. This October the 20th, at our Ageless Health Seminar. It's going to be at the Fairview Park Marriott Hotel in Falls Church, Virginia. It's our keynote. Many of you have been before, and you know that we change the information every year. It's our attempt to give you an inexpensive way of compiling tons of information. You're going to go away from this power-packed. You're going to walk away with tons of material that you can apply immediately. This year's title is How to Live Well and Prosper in a Stressful World. The October 20th seminar is one that you don't want to miss, not for 2 seconds. We have a friend. I have a friend, a colleague, a genius, Dr. Evan Mladenoff. He's going to be there. Evan was the doc for the Kansas City Chiefs. He's well known throughout the world. He wrote a book called Stressed Out, Headed for Burnout. He and I just spent a wonderful couple weeks together in Asia learning some things that are very powerful. And we're going to share a lot of that with you at the Ageless Health Seminar. But Evan's going to talk to you about the emotional side of healing. He's going to show you how it all comes together. Ageless Health 2012. Even though individual discounts are not available because you missed the date, but guess what? If you register 2 of you, you will still get a discount. Go to rosellecare.com. That's ROSELLECARE.com. And go to the tab that says Ageless Health 2012, pull it down, and it's going to tell you all about that seminar and how to register. But don't wait, because we're getting full real quick this year, and obviously there's a lot of you that want to be there with us. We present, we produce, we invent. It's going to be a day that is just phenomenal. Ageless Health 2012. Go to rosellecare.com to register. Let's talk a little bit about your feet and why they hurt, until you decide you want me to talk about something else. But treatment for plantar fasciitis is, it's something that's approached from a lot of different fields, and most of them don't know how to really fix it because they don't address the why is that. Remember I said anything that goes on, there is a why. You have to understand the why to fix anything. There's either trauma, or it's biochemical, or it's a stress pattern that's where your weak spot is, if you will. But plantar fasciitis is the most common cause, and here's what the thing is, heel pain. And it's not just your foot hurting, but it's actually heel pain. So if it's not also in your heel, then it's not plantar fasciitis. It's it's an involvement of a flat fascia, a tightening of what looks like saran wrap or plastic wrap that wraps around the Achilles tendon as it inserts into your heel, the calcaneal bone. And it's what gives you your primary support of your arch. If that isn't working the way it's supposed to, you got a problem. If it gets weak, if it's swollen, if it gets irritated, meaning there's a lot of inflammatory reaction that's going on, it causes you to be in pain all the time, and you can't stand, you can't walk, you can't hurt. But is it in the foot? And that's the whole thing that we really have to consider. Is it in the foot? Is plantar fasciitis the most common middle-aged type of problem that shows up? Also occurs in younger people, but they're usually people who are on their feet all the time, like athletes. You're playing tennis, you're out on the golf course, you're doing that sort of thing. Your feet end up hurting because you look at that game as not a sport, and you fail to do the things that you need to do. And we're going to talk about what I mean by that as we go through the process of unveiling, if you will. But when your feet hurt, it can happen to one foot or it can happen to both feet. So, if it's one foot, there's guys out there that say, well, it's an inflammatory reaction that occurs because of, sometimes they're going to say it's bacteria, sometimes it's an infection. Well, maybe, but I doubt it. It's really not that type of situation. It's caused by a strain of that ligament, that calcaneal ligament, as it goes into the heel bone, and it's wrapped by these hard fascia-like substances. And the problem is why did it start straining to begin with? Did it just because you jumped on it, because you hurt it in some way? Sometimes that can be it, but it can be because of an imbalance in your feet. It can be because your calf muscles are too tight. It can be because your low back is out of position. It can be because the acupuncture meridians that go to it aren't firing properly. The calf muscles generally are a culprit, and they can be a culprit for many reasons. It can be because the nerve that goes to the calf is being irritated. It can be because you're overweight, you have too much weight on the feet, on the muscles that support you standing. That can also be a problem. So how do I really know? How do you really know that you got a problem? We're going to talk about how to fix this, because the fix is not difficult. It's actually straight up. It's pretty easy. But what are the symptoms? How do you know that you have a problem? Well, when plantar fasciitis comes about, you got pain. That's the first thing. And, whether you get from a sitting to a standing position and you put weight on your heels, or you get out of bed and you stand, or you walk around and you stand, you got heel pain. That's the way it is. Without heel pain, you don't have a plantar fasciitis. You may have other problems with your foot, but that's not a plantar fasciitis. But your foot may hurt more as time goes on through the day, or here's the flip side of it. It may hurt less. Why would that happen? Why would it hurt less if you walk around on it? Well, we're going to talk about that in a second, too. So if you have foot pain only at nighttime, you may have a different type of problem. It can be an arch problem. It can be something that we call tarsal tunnel syndrome. We've talked about carpal tunnel syndrome in the hand. So when your hand goes numb, particularly your thumb and your index finger, that's really a true carpal tunnel. But we have something in the foot, these tarsal bones, that are the analogous to the carpal bones in your hand, and that may cause the problem in your foot. So how do we look at this thing? First you have to do is we have to look at you walking. We have to look at you standing. We look at posture patterns. In our office, we have this mat. So all new patients get to walk on this mat. And what we're looking for is your propulsion across the mat. Does your heel and your foot hit the way it's supposed to? Are you pushing off on your foot on the areas that would give you the most support? If not, what's happening? Where's the weight being shifted? And that gives us an extrapolation upwards of whether it's a knee problem, perhaps even a low back problem, sometimes even further up than that, because all the systems are connected, so you really have to understand that. But the bottom line is that most of these conditions that affect the foot are not fascial-related problems when we call plantar fasciitis, because it has to do with the heel first and then other structures secondarily. Your symptoms, such as pain, is diagnostic based on what type of pain it is and when it hurts and where it hurts. Then we ask, the activity. Are you a golfer? Do you do anything besides golf? Do you stretch? Do you really work your muscles out? Do you do any type of other exercise? Has your back bothered you? Do you have pain that seems to radiate down into your legs, or do you not have pain? Do your legs just feel weak? When you go upstairs, does that hurt you more? When you go downstairs, does that hurt you more? Why are those questions important? The reason that they're important is because they single out the structure. They tell us what's going on and where it's going on. And that's important. That's critical. You need to know how the body mechanics work to be able to fix something, because if you don't understand that, you can't fix anything. We're at 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're broadcasting to you from 105.9 FM and AM 630 WMAL. I want to say hi to all of you folks down south of Fredericksburg, because I didn't realize we reached all the way down there. I've been on the beach with my family for several days, and we came up and I was listening, to WMAL, and I said, oh my gosh, you're all the way down there. So we're going to have to do something special for you folks, and perhaps come down and do a seminar or presentation, so we can say hey and, answer your questions. And by the way, if you'd like to get a hold of me when I'm not on the microphone, all you got to do is go to rosellecare.com. That's ROSELLECARE.com. Leave me a note. I'll get back to you. And, if I can't get back to you, one of my staff will, and answer your question very, very specifically. But we're here for you, and those are the reasons that we continue to do this program, is to educate you so you can take control of your life and the things that are happening to you. So what else can happen in a foot problem? Well, we have to look at, are there any other dis-ease, dysfunction that's been going on in the body over a long period of time? Let me give you the skinny on most plantar problems. We're going to get into more involved presentations, but here's the deal. Your calves and your low back are way too tight. They're way too tight. You've got compression on the nerves that go into the legs, and your calf muscles need to be stretched. And remember I said there's a nutritional piece to it? Guess what it is? It's vitamin B12. Most of us are highly deficient in either the quantity of B12 in our bodies or the ability of the body to take it in absorption. See, the primary nutrient for fascial-related anything, this saran wrap that goes around every structure in your entire body, is B12. When B12 is down, then you produce all kinds of symptom processes, including not only anemic situations like not enough red blood cells, and the red blood cells are too big, and it goes on. But more importantly, the fascia also tightens not only in your calf, but other places as well. Got several of you calling in. We're going to take one of your calls before the break, because that's coming up pretty quickly, so let's go to the phones. It's Dr. Roselle.
Yes, good morning.
Sir, how are you?
Okay.
You're going to have to forgive me, because Luke and I are sitting here trying to man the phones and the microphone today, and we can't get everything on the screen, so I don't know what your name is. So what is your name?
My name is Charles.
Charles, thank you for calling. I appreciate you very much. How can I help you, sir?
I have a relative who's 91 years old and has numbness in his legs and in his hands. He has spinal stenosis, but orthopedic hand doctor says that he has carpal tunnel syndrome and recommends surgery, and I'm just wondering what you think about that. I'm not too crazy about him going through surgery, and I'm not convinced that it isn't related to the spinal stenosis.
It probably is related to the spinal stenosis. I've got about 40 seconds, but I'm going to hold you over, so don't hang up, because it's an important conversation. The numbness that you have, the fact that it's in both extremities, it's in the hands and the feet, says to me that it's spinal related. The fact that it's been diagnosed as a stenosis, meaning the canals are narrowed, they're either narrowed because the discs are degenerative or there's actual spurs and calcium that go into the canal, are going to put pressure on the nerve roots that go to those areas, and one of the symptoms is going to be numbness. If he has any kind of blood sugar handling, that's going to make it even worse, because one of the things that we see with diabetics or potential diabetics or pre-diabetics is that loss of sensation. Charles, don't go away. I've got to take a break. I want to continue this conversation with you. Just hang on for a second. This is Dr. Tom Roselle. We'll be right back.
105.9 FM and AM 630. Washington's Mall, WMAL. Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625, 888-630 WMAL. Love to talk to you. Let me give you a little hint for all that heat that's out there. Go get yourself a liter bottle, and I want you to put about 5 ounces of apple juice. Go get some organic apple juice, and then I want you to put 1/8 of a teaspoon, 1/8 measured teaspoon of sea salt, and fill the rest of it up with water and sip on that throughout the day. Get another bottle of water and just sip on that. But I want you to get a little salt, and I want you to get a little natural sugar in your body today so you don't go down the tubes. It is one of the best hydrators you're going to get, far better than Gatorade or on that other garbage that's out there. This stuff works, and it works really well. 888-630-9625. Want to remind you, if you'd like to register for Aegis Health, go to rosellecare.com, but also, more importantly, take a tour around. A lot of you have not been to our iStore yet. Go to the website and click iStore. Go see what we have. There's some deals that we've worked for you with different manufacturers. Really interesting stuff, even from things like sunblock to there's Aquasana has a deal there for you. They'll actually give you a 20% discount. You deal directly with the company. We just worked it out for you. So there's a lot of really interesting things. Go to rosellecare.com. Charles, are you still there?
Yes.
Okay, so let's talk a little bit more about stenosis and the fact that stenosis is, again, a narrowing of the hole, the canal. It's called the foramina, the intervertebral foramina, where the nerve comes out, and it can happen for a lot of different reasons, whether it's spurs, degenerative changes, so forth and so on. But when somebody of 90 years old has that type of problem and they're having numbness in their hands and their feet, it's probably, there may be a carpal tunnel related condition, because when the nerves come out, they go into the forearms and they control the muscles of the forearms, so the hands aren't as strong, so the bones don't stay in place, meaning the carpal bones. And here we're also, by the way, talking about a fascia. There's a big fascia that goes around the wrist. It's called a retinacula. It holds the carpal bones in place. But there's a couple things. With somebody of that age, I can almost guarantee you their B12 level is going to be very low, and besides the nerves being compromised. What I do know works for that type of condition for anybody of any age is acupuncture, nutritional intervention, and gentle traction of the different joint spaces. Somebody that old with that type of profound stenosis, we wouldn't be doing any hard manual manipulation, but there's ways of achieving the same result with different types of procedures, but he can be helped. But B12 level, particularly sublingual, he probably doesn't have the capacity to digest it if it's not sublingual, but you want to match it up with enough folic acid. And the type of B12 that he wants to take is either the methyl form or the hydroxy form. The cyanocobalamin is not a good form. It doesn't absorb really well, but the methylcobalamin or the hydroxycobalamin do. Those are just the different types of B12. Now, you can go back and listen to this again, or you can get a hold of me at rosellecare.com. But there's a lot that you can do to make a difference in that type of condition, be 90 years old or be 68 years old. Doesn't matter.
So you would be against any surgery?
Absolutely.
And one other quick question, the person who went with him asked the doctor if it could be spinal stenosis, and he says, no, it's carpal tunnel syndrome.
If you can't, carpal tunnel syndrome is just a symptom. The question that the doctor's failing to ask or answer, either way, is the fact that what caused it? And it has to do with other mechanisms. Unless he fell on his hands, unless he's a carpenter banging away with his wrist, unless he's doing push-ups all the time, or does my work where I'm working with my hands all day long, it's unlikely that he has a traumatic-induced carpal tunnel, which means it's coming from someplace else. You may have to do some work on the forearms and so forth, but you're not going to get anywhere until you deal with that stenosis and the muscles that are related to it.
Okay.
Thank you, Charles. I appreciate your phone call. Let's go to the phones. Rodney, how can I help you, sir?
Hello, doctor. How are you?
Fine, Rodney. Thank you for calling, sir.
Yes, the planets have rotated and orbited back to the point I think I may have talked to you a couple of years ago. Let's begin with the known and work toward the unknown. What's your question?
What's the question, Rodney? We're coming up to a break.
Your medical help to people is really astounding, especially when you can deal with it in a local setting. I've been diagnosed with intractable plantar keratosis by my podiatrist, and I have had, since getting treatments from him, a host, an array, a syndrome of other things that you have discussed this morning. And beginning with the known would be a traumatic spinal injury, 16 years ago or thereabouts, and when untreated, invasively or otherwise, did go to a chiropractor early on after the injury, and also orthopedic.
Well, let me, we're coming up against a break. Let me tell you something about plantar keratosis. It's a problem. It's a bony problem in the foot, in the plantar aspect of the foot. But here's the thing. In my opinion, it has to do with the arch portion of the foot where it comes off the metatarsal heads, and that's the end portion just before the toes of the foot. And unless that arch is supported, once you've ruled out everything like bone cancers and things like that, you have to begin to rebalance that foot and decrease the inflammatory response in this particular condition. But when they say it's intractable, simply that means that they're not able to figure out the why behind it. They don't have a clue. If it's not a tumor formation, if it's not a hard calculus that they can see and they can extract in some way, and still that doesn't answer the question why it came there, but it can be a cyst that's in the bone, but all those things are caused by something. So let's rule out tumors. The foot has to have support. The acupuncture system has to be looked at, and then the inflammatory levels also have to be dealt with completely. We see that kind of problem in the office actually quite regularly, particularly when it's intractable, meaning they haven't figured out the why behind it. And once you ask the right questions, you can actually put a fix to it. We're coming up to a break. Thank you for your call, Rodney. I really appreciate it. This is Dr. Tom Roselle. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio on this really hot, stinko day out there with a lot of you without power. We're here at 888-630-9625, 888-630-WMAL. Love to talk to you on any subject you have in mind. I want to go back, and unfortunately, the problem with this program, there's breaks and there's shortness, and I can't finish everything I want to talk about. But Rodney called, our last caller, and talked about intractable plantar keratosis. And simply that means it's something that keeps coming back. Intractable means, in my brain, says we can't fix it because we really don't know what the problem is. But everything has a why is that. Every condition is duplicable relative to its pain pattern and its representation if you know what the triggering mechanism is. So here's the situation. Keratosis, and what I didn't tell you about it before, is it's very, very hard callus-like types of substances on the foot. Generally, and I told Rodney that it affects the area close to the metatarsal bones, which are way up into the foot just before the toes come about. And sometimes you see people like this that have their feet look like they're claw feet, and they start rubbing the foot. Sometimes it's due to a tumor underneath the foot, but you develop this large, hard, nasty-looking callus, and it has to be shaved off, and you get rid of it. You go to the podiatrist, and it comes back. But here's how I look at a problem like this. Every joint space, every part of the body has muscles, and muscles are attached to bone. And sometimes the muscles fail to work properly. And going right into what we're talking about today with a plantar fasciitis condition, and I said to you earlier that the calf muscle sometimes is set way too tight, and sometimes the back has nerve root irritation or nerve root compression. That will cause the muscles to either weaken or to strengthen overly so where they're almost in a spasm, so the opposing antagonist-protagonist muscles aren't balanced properly. So now when you stride, when you hit, there's a misfiring. But you have to go in and you have to reset the muscles. You have to go into what we call the spindle cell of the muscle. The spindle cell simply is these long fibers within the cells that give the muscle tone. It gives its position sense. And sometimes they don't work the way they're supposed to. So you have to either go to the reflex patterns, go to the acupuncture points, go to the nerves of the spinal areas and fix them. And you do it over a period of time, re-educate, rehabilitate the foot. And these things begin to have much, much greater beneficial outcomes than they are just by going and have your podiatrist scrape it or putting orthotics that haven't been set properly. There's lots that can be done. Unfortunately, also what occurs is it affects circulation. It can affect the nerves throughout the foot, simply because of the imbalance that occurs generally throughout the system. Anyway, Rodney, I apologize. It's actually something I could talk to you about for quite some time today. If you would like to have some more data, just get a hold of me at rosellecare.com, and I'll get into more detail with you. But you know what? You can be helped. There's more that can be done. It's just that you have to take the time to really figure out what's going on, what the problem is. We were talking about plantar fasciitis, and we're going to continue that, as well as I promised you, talking about a group of people that seem to live longer than anybody else in Icaria, Greece. Isn't that an interesting place? Yeah, it is for me. I'd love to go over there. Let's go to the phones. BC, how can I help you, sir? Thank you for calling.
Hey, morning, good afternoon.
Good afternoon.
Got pain in my left heel. I don't know if you've ever walked barefoot and come down on a cobblestone, do it correctly, and you hit it dead square like a hammer hitting a nail.
Yep.
And it usually goes away in a few days, but this has been persisting for a while. Now, that being said, I did buy some of those little heel pads to put in my shoes, and also let me say that I'm in a business in the summertime where we pressure wash and clean decks, and I don't buy the best quality shoes because they're going to get trashed, if you know what I'm saying.
I understand, but, let me tell you something. I'm going to jump in there just for a second. Let me tell you something about shoes. Your work, your business that you're doing demands that you have good support on your feet. And if you don't have that, you're going to break down. It's like I'm on my feet all day long treating patients, and I go from room to room to room to room to room. If I don't have good support on my feet, I'm going to pay for it over a period of time. It's either going to be my feet that are going to kill me, my calves, my knees, my back, my shoulders. It's going to break down. This is one of those things where the pedal base has to be secure first. So having said that, don't get cheap on your shoes, okay? So go ahead.
So, well, after I put the insert in, I noticed a somewhat relief from that. I also noticed where it gets in my hips, where the upper part of my leg connects into the hips, weren't hurting as much as well. So that's leading me to believe I should either, go get better shoes or just keep with these inserts. Now, then after time, the insert didn't seem to do as well. I don't know if it gets compressed and loses its
they break down. Even good inserts need to be replaced about every 18 months.
Oh, is that right? Well, this was just over barely a 4-week period.
Okay. Well, then you bought some stuff that are just kind of generic and they didn't fit properly. They're probably shifting other things. But look at it this way: if you're putting a deck in, okay, and if the foundation that you put the deck on top of isn't supporting it, the ground is shifting, it's loose. If you get a little trauma into the foundation, then the deck in a short period of time is going to give as well. Correct?
Oh, no, I follow you absolutely. So my suggestion about a better pair of shoes is certainly in order, I guess.
Yeah, you got to get it done, man. It's one of those things that if you don't do that, you're going to pay a price that's awful. But it can go the other way too. A lot of the imbalance that you're having from your feet could be coming from your low back. It could be coming from just really tight calves that are pulling and going to the topic we're talking about with plantar fasciitis. It could be going to that where it's causing contraction of the muscles of the feet. But you've got to get that balance out in your occupation. It's going to pay you long-term to make sure that your structural system is sound, making sure that your pelvis is level, making sure that your muscles are strong, and, as importantly, making sure those feet are balanced properly, because otherwise you're going to have more problems than what you're dealing with. The problem that you're having with that heel pain right now is fixable. We see a lot of folks with that type of situation, and the body has a memory, and that memory gets ingrained into the bone, into the ligament, and so forth if it's not dealt with properly. And then sometimes you can't find it until you bring it out in a very specific way, then treat it. But there's a technique called injury recall technique, or what we lovingly call IRT, that will all of a sudden allow the muscles to show weak. If they are, will show the gait the way it's supposed to, and so forth. But it's fixable. Don't play with this thing, because over a period of time it's going to get worse.
So I should be fitted in this case?
Yeah, you need... Where are you?
I guess, is one of the brands out there.
You in Fairfax?
Yeah.
Okay, you know what I would tell you to do? Come in and see either Dr. Browning or Dr. Lamp in my office. These guys, know their stuff. Dr. Browning deals with sports injuries all the time, and so he's got guys that are on their feet, on their heels, and, they're constantly, screwing themselves up. So he can show you exactly what to do. Dr. Lamp truly understands the foot pedal base, and they can tell you if it's coming from your low back. They can tell you if it's coming from your legs, but it can be fixed. So, do that and send them a note, and they can go back and forth with you. But I would encourage you, based on what you do, so you don't continue to perpetuate the problem, do something, that's straight up.
All right, I play a lot of golf too, so I'm all the time.
Yeah, absolutely. Not a time to mess. BC, thanks. I appreciate your phone call.
All right, we'll give you a call. Thank you.
Bye-bye. 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have in mind. Let's see if we can put a fix to it. We're here to answer your questions, put you in the right direction. Give us a note at rosellecare.com. Anytime, one of us will get back to you and we'll try to put the pieces of the puzzle. There's no reason to suffer because there always is a why is that. You know what the biggest failure rate of anybody trying to get their life straightened out is the unwillingness to continue the process on a day-to-day basis and to shift things properly. Let's talk about some of the healthiest people in the world and the foods that they eat and some things that they do. I was reading some articles, and it struck me the other day that, you know, nutrition is really a pretty straightforward thing if we go back to basics. There was a physician years ago that was a good friend of my father's, and so it goes back many, many moons ago, and he said to my dad's name was Russell, he said, Russell, if you want to be well, eat the way you did when you were a kid, meaning eat the way he ate when he was in the island of Sicily. And all the foods were natural and a lot of oils, and, you know, the foods were quite supportive, a lot of omega-3s, and they ate little bits of things, not the huge amounts of foods that we have now. But we're talking about the people from Icaria, and they're very interesting because they seem to kind of beat the odds across the board. They live well into their 90s. They don't seem to have the problems that everybody else has. But why is that? What happens? What is their daily lifestyle? You know, Icaria is, as we said, is in Greece, but the lifestyle is every bit as important as diet, in some cases probably more important. 4 out of 5 longevity hotspots have very, very similar lifestyles. If you go throughout the plan, you say, okay, who lives the longest? Why do they live the longest? And what do they do? The activities of daily living in these people provide a lot of exercise. They walk, they bend, they lift, they play with the gardens. These people don't have maids, by the way. You know, they're not like us and somebody does the house. They don't have gardeners. They do their own thing. If they break something, they fix it themselves. Their meals are often prepared from scratch. That means whole vibratory foods. They wash their dishes by hand. I mean, we live in Washington. All of you are saying, yeah, right, I'm going to do all that stuff. Well, here's the deal with these people. The Icarians have a very, very low stress pattern in their body because they enjoy the moment. They enjoy everything that's in front of them. They have very, very strong social and spiritual and family interactions. They like people. They like getting together and just talking with people. And it may not be, you know, where they set aside tons of time, but they like being with each other and they don't judge people. And if they get into a tiff, it kind of gets blown off real quickly. Icaria, the area of Greece that we're talking about, is 99 square mile Greek island. And it's closer actually to Turkey than it is to the mainland of Greece. And we won't tell the Greeks about that, but even though it's a Greek island, the Turks have a really large influence. And it's a rocky island. It's kind of, you know, not an area that you would think about. And the temperature and climate has one of the highest levels of health and longevity of any place that you can possibly think of. 2009, a team of researchers that were sponsored by the National Geographic Society and the American Association of Retired Persons, AARP, not one of my favorite groups in the world, but they spent a 3-week process studying the demographics of these Icarians. And it was published in 2010. And together, they provided a host of interesting statistics on these 90-year-old plus, well into their hundreds. Interesting statistic, for example. If you were born somewhere in the neighborhood of 1946 to 1964, you have a 1 in 9 chance of living to be 90 years old. The same period of time for the Icarians, you have over 3 in 9 chance of living well into your 90s and into 100. That's amazing. So why is it that these folks beat the odds across the board more so than anybody else? Well, the most amazing statistic was the virtual absence in these people. And get this one, the virtual absence of dementia. I mean, their brains are intact. They function at a very high level. In 2009, when they did the study, when National Geographic and AARP did this study, they sponsored this investigation and interviewed 1/3 of all the living 90-year-olds on the island, 1/3 of them. And now there's a ton of them there. And none, not one, none of these subjects in their interview sample, and it was a huge sample, had any dementia, not even a predisposition to it. 40% of those who reach 90% in this country have some form of cognitive impairment up to and including full-blown Alzheimer's disease. What is that all about? I mean, that's got to make you stop and think. They have their brains. They have the capacity. They do what they want to do. They can think just as they thought years ago. They process just like they processed years ago. Well, we're going to talk about lifestyle, by the way, at Ageless Health, how to live well in a stressful world. We're going to talk about some of these things in much more detail, but I want you to understand something. A full 82% of the Icarian men over 80 were former smokers. So it wasn't the smoking. 17% of those that they interviewed were still smokers. So what's that all about? Maybe the tobacco was better. Maybe they were smoking something that was even, more supportive. I don't know. I'm not making any conclusions here. I'm just reporting the information that just kind of blew my mind as well. But there's some key dietary patterns to these folks. In the Icarian study, and it was of 1,430-some inhabitants, they came up with some really interesting stuff. And, they found that the Icarian diet includes an abundance of local vegetables eaten in season, not hothouse stuff that's grown locally. When you have local fruit here, that's the fruit you're supposed to be eating. When you have ground stuff, the things that grow in the ground, that's when you eat those things. And they eat a little bit of Greek goat yogurt. They eat a little bit of wild game. They eat a little bit of fish. Not a lot, by the way, just very, very little bit. A lot of nuts and seeds and so forth. And they drink tea, herbal teas, from early in the day to late in the day. These Icarians are amazing people. A lot of information out there, and we're going to continue to share them with you. But right now we have to take a break. Don't go away. You're listening to Dr. Tom Roselle Live.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. Have been broadcasting you from 105.9 FM and AM 630 WMAL. We've been here at 888-630 WMAL as we are every Sunday at 12 noon, bringing you the most enlightful information as we possibly can, trying to make you think, trying to get you to take control of your health, trying to make you responsible, not somebody else. And now with the days of Obamacare settling in, you better take control of your health. You better learn as much as you possibly can. You better become the captain of your ship, because let me tell you something. If you don't, somebody's going to tell you what to do, and you may not like the outcome. We are going to become, my opinion, even though that this healthcare system, by the way, let me emphasize that, needs some changes. The way it's laid out right now, somebody's going to direct and tell you when, how, and what for as this thing begins to implement. I don't particularly care for it, but it's my opinion, and I will write upon it, and I will blog upon it, and you will understand why. I don't think this is ever going to go away, no matter what they do, but I think that the implementation and the guidelines can be changed dramatically. So get involved and, become proactive. Don't just complain about stuff. Actually become proactive in what you're doing. We're going to take one phone call very, very quickly. Dale, how can I help you, sir? Thank you so much for calling.
Oh, you're welcome. Two quick questions. One, how much B12 might a person need to take care of your feet problems, and what services are offered, how many doctors, where are your offices? Since I've never heard you before, I think you're awesome and want to know that.
Well, thank you very much. Okay, so let me answer the first one first. If it is a B12 problem, then we normally overload the system. B12 is not going to be a problem. It has to be a sublingual form. And let's say if it is a hydroxycobalamin form, you want to take something in the neighborhood of about 1,600 units 4 times a day to start with. And sublingual, and you're going to accompany that with about 1,000 units of folic acid each time you take the 400 units of B12. Now, most physicians will tell you, oh my God, that's overloading the system, but it isn't. And what you're actually looking for is you're looking for the B12 on blood levels to go above the normal level so you can force transportation. And then you begin to cut it down, and there's a way of monitoring how much and so forth. Let me tell you a little bit about the practice, because we're coming up to the end of the program. We are a practice that there's I think 12 practitioners at this point. 5 of them are chiropractors that specialize in orthopedics, in applied kinesiology is our specialty area, in neurology, in different forms of nutritional functional medicine. We have 2 trained acupuncturists who are trained in traditional Chinese medicine. We have 2 massage therapists who do some very interesting work with myofascial work and lymphedema and so forth. We have a nutrition department. There's 2 people in that do a lot of functional medicine work. My intervention in that, even though that I don't see as many patients as I used to, is to oversee the cases. And what we do is we put everything together. We look at each patient from an acupuncture point of view, from an applied kinesiological point of view, from a functional medicine point of view, and try to figure out what's the best approach and how do we handle that. Dale, if I can be, more direct, please get a hold of me, and you can do that online or you can do that by phone. I'll be more than happy to talk to you at any point. Problem with the program is we're coming up to the end, and we have more phone calls, and I'm very sorry that I can't get to you, but I will answer you if you get a hold of me off the air. See if we can make this thing longer, because I really want to handle everything for you, and I want to empower you, and I want to give you the information that you need to have and send you. I want to make it controversial, so help me do that. Maybe we can do it together. This is Dr. Tom Roselle. I will be here next Sunday at 12 noon. See you then. Bye. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program. It will show you how your decisions can lead you to a life without impairment. You're in control. Health is a Do-It-Yourself Program.
Health is a Do-It-Yourself Program. Ageless Health 101. Available in paperback and CD. Featuring 3 easy-to-listen-to and follow-along CDs with bonus music selections, Finding Peace and Change is Beauty. For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellcare.com or by calling 703-698-7117. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.